Hi guys, so today we're going to be talking about the physical and cognitive development in teenagers. We're going to describe the important features of physical growth in the teenage years, and we'll also be covering the changes in health, intelligence, information processing during adolescence, and also we're going to talk about the reasoning about moral issues. So before we start, let me ask you, what is puberty? And I'm pretty sure you guys have had this topic covered and been taught in elementary and high school. So it's easy for you to answer in a sense. When you're thinking about the definitions of puberty, really it is a collection of physical changes that mark the onset of adolescence. And these physical changes include the emergence of the breasts, the enlargement of the penis, and of course the appearance of body hair. So at what age you notice the body is physically changing, it depends on the person, as well as their feelings about these changes. Puberty, when we're talking about puberty, there's generally two general types of changes. The first type of pubertal change is the bodily change, and this, of course, includes usually includes a large increase in height as well as weight. And the second one is sexual maturation. So this includes the change in the reproductive organs and the appearance of secondary sexual characteristics such as body hair. And we'll be talking a bit more about these changes later on. Girls begin their growth spurt about 2 years before boys do. Girls at about 11 years old reach their peak rate of growth at 12 years old and achieved their stature, their height at about 15 years old, while boys begin to hit at their big growth spurt at 13 or 14, and they reach their height at 17. So the 2-year difference in growth spurt can lead to some awkward social interactions between 11 and 12-year-olds because the girls are often much taller than boys are. And now what happens during the growth spurt, when you're born, so the bones become longer and denser, the muscle fibers at puberty become thicker and denser, producing substantial increases in strength, particularly for boys. As for girls, their body fat increases more rapidly rather than their muscle fibers. For boys, heart and lung capacity also increases. So these changes explain why typical adolescent boys are much stronger and quicker and have greater endurance than that of girls. Apart from obvious body changes, the brain also grows. And at the beginning of adolescence, the brain is about 95% of the size and weight of an adolescent's brain. And another thing is that the two features of brain development that begin in early life are nearly complete. These are myelination and synaptic pruning. The myelination is the acquisition of the fatty insulation that allows neurons to transmit information faster. The synaptic pruning forces weeding out the unnecessary connections between the neurons. So these changes mean that the adolescent can process information more efficiently than a child. Not all the regions of your brain reach maturity, which of course leads me to my next question. What makes adolescents vulnerable? So they're vulnerable because the reward and pleasure-seeking systems are more mature than the behavioral control. And what that means is that some brain systems are sensitive to reward, and they may reach maturity and for adolescence, but the systems responsible for self-control aren't fully specialized until adulthood. Even though adolescents may know that behaviors involve risk, the anticipated rewards and pleasure of risky behavior pushes the idea of risk away. And this makes adolescents vulnerable to high-risk activities and, of course, bad decisions. So moving on to sexual maturation. Can you still recall what are the two types of sexual characteristics? So we have the primary and secondary sex characteristics. The primary sex characteristics refers to organs that are directly involved in reproduction, and these organs include ovaries, the uterus, testes, and penis. For secondary sex characteristics, these are physical signs of maturity, external signs, and they're not directly linked to reproductive organs, but are kind of side effects. These physical signs include the growth of the breasts, the appearance of facial hair, the start of menarche, which is the period, sperm production. So for girls, obviously, this is occurring typically at about 13 years of age, and it's usually regular and without ovulation. For boys, we have the first spontaneous ejaculation of sperm. For months or years after, this can produce sufficient sperm to fertilize an egg, just like girls. It also typically occurs at about 13 years old. And what causes the many physical changes that are occurring during puberty is our pituitary gland. The pituitary gland releases growth hormones, regulates pubertal changes. As for girls, it signals the ovaries to release estrogen, which causes the breasts and genitals to mature and fat to accumulate. For boys, it signals the testes to release androgen hormone, testosterone, which causes the male genitals to mature and also muscle mass to increase. Although estrogen, of course, is often described as a female hormone and androgens as a male hormone, estrogen and androgen are present in both boys and girls. So there are psychological effects of puberty that need to be discussed. It's not just physical. So the psychological effects, body image in adolescence is important. They're concerned about their overall appearance more than adults or children. Many teenagers look in the mirror regularly to check for signs of additional physical changes. Generally, girls are particularly likely to be unhappy with their looks. Boys don't pay as much attention to that, although they certainly do some. They're concerned about what their peers might be saying about their looks, particularly the girls. Response to menarche for most girls, they usually tell their moms later on. They tell their friends first. Most girls are generally pleased that they are growing, but they're also irritated at the inconvenience, the frustration, the pain. As for boys, most know about spontaneous ejaculation beforehand, and not by asking their parents, but by what they're reading, watching videos, asking friends. In contrast with girls, they feel more positive about their first menarche. Teens tend to be a bit more moody, extraordinarily moody sometimes, moodier than children or adults according to the research. Scientists often find that the rapid increases in hormone levels are associated with greater irritability, greater impulsivity, and of course greater moodiness. Teens are more likely to report being in a good mood when hanging out with friends or when doing recreational things. So the rate of maturation early can be harmful for girls. Girls who mature early often lack self-confidence or are less popular or more likely to be depressed and have behavioral problems. Maturing early can be harmful for boys too because they're at risk for psychological disorders such as depression, although they generally do a lot better with early maturation. For both girls and boys, maturing late poses few risks. Late maturing girls fare better than late maturing boys. They are somewhat greater risk for depression and being teased. So we're done with the pubertal changes. Now let's talk about health and adolescence. So just as a reminder, number one, girls tend to have their growth spurts about, do you remember how much earlier than boys? That's about 2 years. So primary sex characteristics are organs directly related to reproduction, whereas secondary sex characteristics are, do you remember? Let's see if you get these. Number 3, during adolescence, physical growth, boys have greater muscular growth than girls and acquire less what? See if you guys can all remember these. What are the 4 mentioned psychological impacts of puberty, and who does better with late or early puberty? These are things that you should know. Okay, girls tend to have their growth spurt about 2 years earlier than boys. For number 2, primary sex characteristics are organs directly related to reproduction, whereas secondary sex characteristics are not directly related to reproductive organs. Number 3, boys have greater muscular growth than girls and acquire less fat and have greater increases in heart and lung capacity. For number 4, the last number, the 4 mentioned psychological impacts of puberty are body image responses, response to menarche and spermarche, moodiness, and rate of maturation. Let me know if you guys like me throwing in these questions like this. Okay, let's start with nutrition. So the physical growth associated with puberty means that the body has special nutritional needs, which we do not often get in America because we don't eat well. A typical teenage girl should consume about 2,200 calories per day, while a typical teenage boy should consume about 2,700 calories per day. Girls need hemoglobin to replace what's lost in menstruation, or they can get iron deficiency, while boys need additional hemoglobin because of the increased muscle mass. Both need more calcium for bone growth and iron to replace that, to do well. So next is obesity. Adolescents were in the upper 5% based on their BMI or body mass index. And those who are in the upper 5% are considered to be overweight, and they are often unpopular, at risk for depression, anxiety, prone to many medical problems such as high blood pressure, type 2 diabetes. No single factor causes children to become obese. So what is causing that? Heredity, genetics. Obesity runs in families, showing that genes contribute perhaps by causing some people to overeat or to be less able to convert fat to fuel or to be more likely to have an emotional response to eating. Some parents urge their children to clean their plates even when the child is not hungry. That's debatable about how much of an effect it has. But certainly parents often use food to comfort children who are upset, and these practices can cause children to rely on external cues to eat instead of eating only when they're hungry. A sedentary lifestyle is important, is a big factor. Youth are more prone to obesity when they're physically inactive, such as watching television instead of playing outdoors. And a big one that we don't think about is too little sleep. Adolescents who don't sleep enough tend to gain weight, perhaps because they have more opportunities to eat because they're awake longer. Moving on from this is eating disorders. Okay, so we have anorexia nervosa and bulimia nervosa. So this is a disorder marked by a persistent refusal to eat and an irrational fear of being overweight. On the other hand, bulimia nervosa is people with bulimia may secretly binge, eating large amounts of food with a loss of control over their eating, and then often purge, trying to get rid of the extra calories in an unhealthy way. So this is a French model, Isabelle Caro. She sadly died when she was just 26 years old because of anorexia nervosa. And yeah, she's definitely proof that anorexia, like other eating disorders, can take over your life and can be difficult to overcome. And sadly, the modeling industry promotes women like this. So if you have this issue, this eating disorder, it's an issue of self-worth. But with treatment, you can gain a better sense of who you are, return to healthier eating habits. It's also a way to control your life. So it's important, of course, to maintain your physical fitness and your health, but it shouldn't be overwhelming, right? So being healthy can reduce the risk for obesity, cancer, heart disease, diabetes. Plus, engaging through regular activities can make you happier. It can bring all sorts of benefits to you. So this is typically exercising for 30 minutes, at least 3 times a week. Keeping the heartbeat at about 140 beats per minute improves mental health, helps build stronger muscles, lungs, bones. I mean, obviously you know that this is important, although we don't act on it. All right, so threats to adolescents' well-being. In the U.S., adolescent boys and girls are more likely to die from accidents involving cars or firearms than any other single cause. And also suicide is one of the highest risks to adolescents. So risky behavior does appeal to adolescents because of that lack of self-control and also that reward and pleasure-seeking system that are more mature than the self-control system. Yeah, pleasure plus excitement equals risks, and lack of self-control minus self-control. So adolescents also often think that taking risks is fun, and adults feel this way too, but their self-control system is more developed. And so that's the big difference between a teen and an adult with that part of their brain. All right, so some questions for you. Individuals with blank alternate between binge eating and purging. 2, regular physical activity helps promote blank and physical health. 3, an adolescent's diet should contain adequate calories, blank, and iron. 4, what are the 4 factors that contribute to a child's obesity? So the answer for number 1 is bulimia nervosa alternates between binge eating and purging. Anorexics don't binge eat, although they sometimes purge. For number 2, regular physical activity helps to promote mental and physical health. Number 3, an adolescent's diet should contain adequate calories, calcium, and iron. And number 4, the 4 factors that contribute to a child's obesity are the parents, their heredity or genetics, too little sleep, and a sedentary lifestyle. All right, let's talk about information processing. I go on from this during adolescence. There are 4 information processes during adolescence. First is working memory and processing speed. Second is content knowledge. Third is strategies and metacognitive skills. And the last is problem solving and reasoning. So working memory and processing speed. Working memory is the site of ongoing cognitive processing, and processing speed is the speed with which people complete basic cognitive processes. Okay? So adolescents' working memory has about the same capacity as adults' working memory, which means that teenagers are better able than children, obviously, to store information needed for ongoing cognitive processes. So yeah, teens can think just as well as adults, just a little bit different. Their content knowledge, adolescents' greater knowledge of the world, this helps them to facilitate new understandings and memories of new experiences. So, for example, many parents turn to their teens for help in learning how to use their smartphones or whatever technology. And this increased knowledge is useful for its own sake, but it also has the indirect effect of enabling teens to learn, to understand, to remember more of new experiences than a child would. All right, so strategies and metacognition. As a teen's content knowledge increases, teens also become better skilled at identifying strategies appropriate for a specific task and monitoring the effectiveness of the task, the chosen strategy, to verify that it's working. For example, teens make a list of material they don't know well, like a list of assignments, quizzes, tests for a period of time. And these activities would help the teen to learn more effectively, to remember more accurately. Okay. So one of the big differences between teens and adults is their problem solving and reasoning. This is basically solving problems, 2 approaches to solving problems. First approach is the heuristic solution, and the other one is an analytic solution. So let's say you have a situation where you can differentiate the difference between heuristic and analytic solutions. So so this person wants new shoes, and a website reports that one shoe is the best option, but her mother says Adidas are the best option. So which shoe brand should this person get? A heuristic solution relies on personal testimony from someone familiar to you, while an analytic solution relies on statistical information, like from consumer ratings. So should you listen to a friend or should you listen to the star reviews? All right, so let's talk about moral reasoning. So an influential theory proposed by a guy named Lawrence Kohlberg, Kohlberg's theory. Okay, so let's give a scenario of Kohlberg's theory. So the famous one is Heinz and the drug. So Heinz's wife is very sick. He goes to see a doctor, or she goes to see a doctor. The doctor tells her that she has a life-threatening illness and she only has a month to live. But there is a special medication available at a special pharmacy. So Heinz and his wife Clara go to the pharmacy and get the prescription. Unfortunately, the prescription costs a huge amount of money, and they can't afford to pay for it. So Heinz has thought of stealing the drug from the pharmacy. And this is where Kohlberg's theory comes in. Okay, so the first level of Kohlberg's theory is called pre-conventional. And the pre-conventional level is where moral reasoning is based on external forces outside of a person. This is where let's see, the characteristics of pre-conventional. What am I saying here? Okay, so obedience and orientation. So this is where the person obeys rules to avoid punishment. You do what's right because you're afraid of the possible punishment. For example, I would not steal the drug because I don't want to go to jail. That's stage 1. Stage 2 is instrumental orientation. So this is where the person does what is right because of personal gain. So I know that I am rewarded, so I behave accordingly because I get the reward, or I get a punishment. For example, I would steal the drug because if I steal the drug and my wife lives, I will be considered a hero. So again, these are both external. Now, the conventional level is where moral reasoning is based on society's norms rather than punishment or reward. So the characteristics of stage 3 and 4, the conventional level. Stage 3 is the interpersonal norms. So this is where a person does things to please others, interpersonal. The right and wrong is actually determined by the majority. For example, a good boy or a good girl doesn't steal, or a good husband would steal to save his wife's life. Those are what's expected, the norms. The fourth stage is the social system of morality. So this is where the person does what is right to confirm a societal loss. So, for example, I will not steal because it is against the law. Or most honest people would steal to save their wife's life. The last level is a post-conventional. Okay. This is where morality is based on a personal moral code. Okay, so characteristics of stages 5 and 6. Stage 5 is the social contract. This is where the person does what is right for the sake of his fellow, for the sake of society, for the good of society. You do what is right even if it's against the law. For example, I would steal the drug because I'm a Christian and I can't justify losing a human life because all life is sacred. Stage 6 is universal ethical principles. So this is where the person does things according to his conscience. So you develop internal moral principles, and sometimes you do things that is you view it as above the law. For example, saving the most amount of lives, even if it broke a law. Saving the most amount of lives is always the best possible decision, so you would steal the drug. So evaluating Kohlberg's theory. Research supports many features of Kohlberg's theory, so it is well supported by research. For example, Kohlberg proposed that individuals move through the 6 stages only in the order listed, and longitudinal studies confirm this prediction. And on some of the other features of the theory, though it doesn't fare as well research-wise. For example, Kohlberg claimed that the sequences of the stages are universal. As we grow up, we move through the stages, but that is not actually true, except for the earliest stages of moral reasoning. So in other cultures, their morality is not often well captured by Kohlberg's theory, mainly because not all cultures and religions share the theory's emphasis on individual rights and individual justice. And it's also inconsistent with Kohlberg's theory in the sense that the impact on the membership of the social group on moral reasoning, promoting moral reasoning. So moral reasoning applies to critical analysis to specific events to determine what is right or wrong and what people ought to do in a particular situation. So this means that the teen should have the initiative to understand a situation so that they can decide what is the right thing to do. And certain cultures promote moral reasoning more than other ones do. So these are the factors that do promote a more sophisticated reasoning skills about moral issues. The first is observing others and like seeing what happens to them and how they think through things. For example, older friends don't wait to be rewarded to help others, or maybe they even get punished for helping others, but they still do it. The next is discussing moral issues with peers, teachers, parents, so on. For example, when a teen is free to express their opinions and about moral issues to their parents, who in turn express their opinions, and thus they expose their adolescent children to more mature moral reasoning. So talking about it around the dinner table or something. So the next is being involved in a religious community. That's very helpful for developing morality. It connects teens to a network for caring peers and adults. They interact with individuals in the network that kind of earn their trust, share their values, and communicate values. So teens gain a sense of responsibility and concern for others. All right, so I know we went through that fast, but I hope that gives you a good understanding, good idea of what's happening in the teenage years. I'm going to post a video for you about how the tween brain and how that develops. It's from another college professor, but it's really good, and it's her research, so I thought it was better if she posted it, or if she lectured on it, and I didn't just re-lecture. So anyhow, if you have any questions, let me know.